Welcome. Thank you so much for joining us. I am Henry Samelin. I am the video production manager of Deuk Spine Institute and also the showrunner for the Deuk Spine Institute podcast. And I'm here today with the one and only, the CEO and founder of the Deuk Spine Institute, Dr. Deuk Majan. And today we want to discuss, get to know you a little bit more on your upbringing and just your journey to become to where Deuk Spine Institute is today. And we just want to get to know you more and just understand your journey and where you want to go with this.
Thank you, Henry. I've been looking forward to this first podcast for Deuk Spine Institute for quite some time. And you and I have worked together now for a few years, and you've had an opportunity to learn about what Deuk Spine Institute really represents, what we're trying to accomplish in the world, which is to cure back and neck pain and joint pain in the safest and fastest, most durable way possible, which has kind of led us to really understand some issues that a lot of people probably don't have much exposure to. No. And, you know, there are businesses, companies out there that are profiting tremendously off of people's misery. Yeah. And we discovered that along the way, and we want to shed light on these companies and what they're doing basically to harm regular, everyday Americans. And this happens all around the world, by the way, not just in America. These truths that we've uncovered along the way, these last 20 years that I've been practicing as a neurosurgeon in the community here in Florida, are truths around the world. You know, these are issues that people deal with all around the world.
Yeah.
So, yes, I'm looking forward to our first podcast.
Exactly, as am I as well. Let's jump right into it, all right? So with this, we're going to start off with, how did your upbringing influence your medical journey?
Great question. Thank you. So I am the son of a physician here in America. My father was an immigrant. He came from Egypt. He came specifically from Alexandria. And the reason he was in Alexandria, Egypt, was because the Armenian people, which I am an Armenian, and my father was Armenian, we were persecuted by the Ottoman Empire, the Turkish Ottoman Empire, for our religion and for our culture, much like the Jews had been persecuted. And that caused a genocide to occur. The Turks had a genocide against the Armenians back in 1915, 16 through about 18. So it was about a little bit over 100 years ago in Armenia and Turkey. Well, that caused a lot of Armenians to leave Armenia and escape persecution and basically death. The Turks were putting Armenians to death. They were taking babies out in the ocean and dropping them in, and basically typical genocidal type behavior. But the Armenians in Armenia had to get out of there, otherwise they were going to be killed. So they left and they went to America. They went to Lebanon and Australia and Europe and Africa. And my family, my grandparents, left Armenia as children and ended up going as children to Alexandria, Egypt, which is where my father was born and grew up. And he became a physician in Alexandria. He took the national test. He did very well. He scored the highest score in all of Egypt that year. And the way the system worked in Egypt was everyone took the national test out of high school, and the top 1% could become doctors, then the next 2% to like 3% engineers, and so on and so forth. So he scored the highest score in the country. He could become a doctor. He went to medical school in Egypt and Alexandria. And once he graduated medical school, this was a time in Egypt's history when there's a guy named Nasser who was in power, who was against Christians, and he made it very difficult. So my father and his family left Egypt. They came to New York and eventually Los Angeles, California. And so my father was an immigrant back in the 60s to New York, and he started to do his OBGYN residency in New York at Queens Hospital. And so he met my mom at that time, a nurse. My mom was a nurse at the hospital. She was a teaching nurse. She was actually a nursing instructor. And the two of them met and hit it off. My father then got drafted into the Army, United States Army, and he was an immigrant. And because he was an immigrant to become a citizen, they were requiring immigrants to basically serve in the Vietnam War. So my father was drafted into the United States Army as a doctor, and he was stationed in Germany. And my mom and him got married in Vegas. They eloped and got married because the Armenian side of my dad's family, they weren't going to let him marry a non-Armenian. And my mom is Irish, Dutch, German, British. So she was not Armenian. And my father's parents were against the marriage. So my father and my mother left and went to Las Vegas and got married. And then they went to Germany, where he served for 3 years in the United States Army, delivering babies for the military personnel. Now, when he finished his 3 years of service, he was honorably discharged back to civilian life. And he came back in his training program where he was doing OBGYN. They said, hey, you've been gone 3 years, you lost your spot. We can't take you again because we're already full of doctors. We're training doctors. You need to go somewhere else. So he found a position to train in Los Angeles, and he and my mom came back with my sister and I. We were just like 2 years old, and we ended up in California. So I grew up in California, Southern California, a place called Thousand Oaks, California. It's where my father set up his first OBGYN practice. So I grew up in a medical family. My dad was a doctor. He was an incredible man. He spoke 7 languages. He loved practicing medicine. He said medicine is just the best profession you could ever do. And I believed him. I saw him working with patients. He loved it. He was a great doctor. His patients loved him. They brought him gifts all the time. They would come in and talk to him. And he just seemed so happy with what he was doing that made a real impression on me, that medicine could be something that I could be happy doing, because I was a lot like my father. And so I could see myself having a great career in medicine, a lot like my dad. Now, I was also a soccer player. I was on the United States junior national team, and we traveled from California. We had players from all over the United States, but mostly California. We went over to Europe, and I played soccer representing the United States. Well, this was back in the early 80s, okay? And I was, 12, 13, 14. We were playing over in Europe against Germans, Austrians, a bunch of other teams from all over Italy.
Wow.
Oh, yeah. It was a junior team.
That's crazy. That's unbelievable.
Yeah.
I love that.
We had about 25 players on the team, and we all traveled on the old, TWA, Trans World Airline planes, which are now
they're not a thing anymore.
Defunct.
Yeah, defunct.
But man, people used to smoke cigarettes on those planes.
Yeah.
Like the whole plane would be full of cigarette smoke, and people would booze it up. And anyway, we would go over to Europe and play soccer. When I moved along out of high school, I started playing semi-pro soccer in Los Angeles, but there were no professional teams back in the 84, 85 era. And so professional soccer was just starting, and I was looking at professional soccer in America. We didn't even have an Olympic soccer team. If you wanted to play in the Olympics in the early 80s, you had to go to Canada and play with the Canadian team. I was offered a position to play on the Canadian Olympic team, but I didn't want to play, for a foreign country's Olympic soccer team. I'm an American, right? I wanted to play for America or not play.
Yeah.
And the opportunities for soccer players back in the early 80s in America, you had to basically go to Europe, and you're going to, they're always going to favor the European players over the American players. And I was a striker. I scored goals. I was a very good player, one of the top players in the country. But I just couldn't see myself going to Europe to play soccer. So I started to really think about, what do I want to do with the rest of my life? And I came back to medicine. I came back to what my father was doing and how happy he was. Now, he got sick with cancer and passed away. He died in basically 1988. So I was just 18 years old at the time. And his death had a tremendous impact on me. It really affected me for a couple of years. It made it difficult for me to study. I was at UC San Diego. I started in 1987, undergraduate, and I started out as an anthropology major, but switched eventually into biochemistry, cell biology, and chemistry, so dual major. I ended up graduating UCSD pre-med, and I went to USC Med School. And it was at USC Med School where I fell in love with the nervous system, which is the brain and spinal cord and nerves. When I went to USC, the first time I went there, I was thinking I'm going to be an orthopedic surgeon, because at the time, if you were an athlete, which I was, and you went into medicine, most athletes went into orthopedic surgery. They became orthopedic surgeons, and they took care of athletes, right? Knee injuries,
yeah, of course,
yeah.
yeah.
So I was going to basically become an orthopedic surgeon, and during that first year of med school at USC in Los Angeles, I started to really look into orthopedics and knee surgery and hip surgery. And to be honest with you, I didn't like it. I didn't like it at all. I thought it was, to be honest, I thought it was kind of boring. And I don't mean to offend any orthopedic surgeons out there. Yeah. Obviously, we need orthopedic surgeons, but for me personally,
wasn't your field.
It wasn't something that really interests me.
Yeah,
you know, and I was kind of like in limbo. What am I going to do? And then at the end of the first year of med school, this was back in '93. I took neurosciences, and they have neurosciences at USC Med School at the end of the first year. It's the last 6 weeks.
Yeah.
So I took the neurosciences, and it was the hardest course I had taken so far in med school. And you have to learn about all the different areas of the brain, the nuclei, the pathways, who's talking to who, what the functions of the brain and nerves were. And of course, this is a subject that I'd never had exposure to before in my career, neurosciences.
Yeah.
And so I started to study it and understand it, and I just fell in love with the brain, fell in love with the nervous system, and that was when I made the decision, I'm going to become a neurosurgeon, right?
Yeah.
So there's 2 types of doctors that treat brain problems, well, 3. There's neurosurgeons who do surgery, neurologists who prescribe medications and run tests,
yeah.
And then there's psychiatrists, psychologists who just kind of talk you through stuff.
Yeah.
Also prescribe.
Yeah.
And I'm not a talker. I'm more of a cutter, doer. So I chose surgery, neurosurgery. At the time, my mentor was Dr. Weiss, who was the chairman at USC. And Dr. Weiss was very supportive of me becoming a neurosurgeon. And my interest at the time was to basically alleviate suffering, people's suffering, pain. Specifically, to get rid of pain. So I shared that with Dr. Weiss, and I remember him saying, nobody serious in neurosurgery treats pain. He said, you're the top of your class, number 1. You're going to go to the top training program in the world for neurosurgery. You should be interested in brain tumors or aneurysms, AVMs, that type of brain surgery. That's really where the elite neurosurgeons go. So I said, okay, who am I to argue with Dr. Weiss?
Yeah,
right? This guy's
no point, yeah.
He's like the most respected neurosurgeon in the country.
Exactly,
right?
It gives you that praise.
He told me what to do, and I said, all right, that's what I'll do.
Yeah.
And of course, I went into neurosurgery at University of Florida, the top program in the world at the time. I trained with Dr. Roten and his faculty, and but I never stopped caring about patients in pain. I never really got interested in brain tumors and aneurysms. Of course, I trained on how to take them out, how to fix them, and I was very good at it. However, I just kept coming back to the suffering, people that are suffering in pain. People in wheelchairs, people on crutches, people in pain all the time, people whose lives were being robbed from them. And I just somehow I was connected to those people. And so I just kept coming back to, how do I get rid of people's pain? And one of the biggest sources of pain is back pain and neck pain. And so it was natural for me to be interested in spine surgery, because the spine is is the source of back and neck pain. So I started, and at the same time, we had a new faculty. His name was Jeff Henn, Dr. Jeff Henn. He came from the Barrow Neurological Institute, trained with the top spine surgeons in the world, Dr. Volkner Sontag and Dr. Curtis Dickman at the time. They were the top spine surgeons in the world. He trained directly with them, did a fellowship in spine. So when he joined the faculty at University of Florida in Gainesville, all the other residents in neurosurgery, they had no interest in spine. They were interested in brain tumors and aneurysms. Yeah. I was like one of the few that actually cared about spine. So I would operate with Dr. Henn every day, and I would do spine surgeries, on the neck and the lower back. And I learned through him the latest and most advanced techniques in the world for spine surgery, because he trained with the best spine surgeons in the world. That's who trained him. And he was a great surgeon and a great teacher. So I had two years of almost direct tutelage under Dr. Henn's work with his patients. And I got to see how he treated his patients, how he diagnosed, and how he operated and performed his surgeries. And I basically emulated everything he did, and my patients had phenomenal results with spine surgery. So that's how I ended up getting interested in spine.
And as you mentioned before, you had just, going through the college and going through your residency and just, getting that significant, all hands on deck with your experience in medical school. What moments or experiences such as that during medical school or residency revealed to you that the spine was misunderstood or mistreated by the healthcare system?
That's a great question. So I started to recognize that the spine was sort of a hotbed of interest for me when I was not in medical school, but in residency. All right. At medical school, I was so busy with my studies that I would literally study every day until midnight. I would start my days at 7 a.m. And when other students were out enjoying themselves, I'd be in the library studying. That's how I was able to be the best in my class. And I really learned the subject matters of histology, gross anatomy, pathology, psychiatry, all of those subject matters. I was able to master them in medical school. As a matter of fact, in pathology, which it is pathology of the spine that is what causes back and neck pain, right? Yeah. Pathology, I scored the highest score in the class in pathology, which I won the Barbara Monroe Award for pathology and the Armed Forces Institute of Pathology Award, where I had an all-expense trip to Washington, D.C., and I visited the Armed Forces Institute of Pathology as the person who won that award. Also, I scored a perfect score on my final in pathology, the first time in the history of USC. And the chairman of the pathology department, his name is Dr. Clive Taylor, he wrote the book on pathology that everybody in medical school around the country used, the Chandra Soma and Taylor pathology, right? And so he came and announced, we had one student who scored a perfect score on the pathology final, which is cumulative for the whole year. Everything's fair game. And they made it as hard as possible. He said, one student in the history of the school of 125 years who scored a perfect score in pathology, that was me. So I took my understanding of pathology, right, and I applied it to the conditions of the spine, recognizing that there was something wrong with the spine that was causing pain, right? And at the time, other practitioners in medicine were believing that back pain, neck pain are non-specific, meaning there is no specific cause. And there was even a belief among many doctors that it's really the patients with back and neck pain, they're crazy.
Yeah, it's a facade. Yeah.
There's nothing wrong with them. They're just looking for attention, or they're trying to basically, what they call somatize psychological illness, which means they're crazy And this is how the craziness manifests itself, right? So there's something called a somatoform disorder where patients with psychiatric illness like stress and anxiety, that stress and anxiety manifests itself as back pain or something. And there's something, even a condition well known, where people will have blindness, right? Where they can't see. They're saying, I'm blind, I can't see. And it's psychiatric. It's all in their head. There's really nothing wrong with their eyes. They're perfectly worked, nothing wrong, but they're blind, right? And if you like movies and you like comedies,
Which I do.
Talladega Nights, right?
Yeah.
Remember when the main character,
Ricky Bobby,
was in a car crash, he was on fire,
Yeah.
and he said, I can't feel anything below my waist. My legs don't work anymore. I'm paralyzed, right? Remember that?
Yeah, he couldn't move. And
then they said, well, let's see how paralyzed you are. And they stuck the knife in his leg or the scissors in his leg. And
took a moment and then
he was up jumping around, right?
Yeah.
So it's called somatoform disorder, somatization, where doctors believe that stress and anxiety and problems in life are manifesting themselves as back and neck pain. But I didn't see it that way because I had some experiences in residency at the University of Florida where I would see patients with back pain have fusion surgery done on their spine. They would come out of surgery the next day or two, and I would interview them and check on them, and guess what? Their back pain was gone. So I recognized through the work of Dr. Jeff Henn, the spine surgeon from the Barrow who was training me, I recognized that people with back and neck pain could be cured. And that went against everything that I had heard up until that time. Because if you talk to pain management doctors, you talk to nurses, you talk to physical therapists, chiropractors, they all will tell you that back pain is something you have to learn to live with and manage, right?
Yeah.
Either through pills or shots or therapy, and that you're going to keep having it the rest of your life. But I saw for the first time back pain cured with surgery on the spine. So that got me thinking, well, if Dr. Henn's fusion surgery is able to cure pain, right? And then why can't we do surgery on the spine to cure pain? And the answer is you can. And so when I got out of my neurosurgery training at the University of Florida back in 2004, I started Deuk Spine Institute here in Brevard County with my wife, son. I recognized that back pain could be cured if you do the right surgery. Now, not every spine surgery is going to cure back pain. Microdiscectomy, laminectomy, those surgeries don't cure back pain. They're not meant to cure back pain.
Yeah.
They're part of the problem.
Yeah.
They make back pain worse.
Yeah. Too invasive.
Yeah, too invasive, destabilizing. But what will cure back pain is if you operate with the right type of surgery on the patient with back pain coming from the spine, okay? So for the last 20 years, especially in the first 5 or 6 years, I was able to further my understanding of back and neck pain from my patients through my experiences after I was trained. One of those experiences was I had the opportunity to go overseas and meet a group of surgeons who were performing breakthrough surgery, endoscopic spine surgery. And even at University of Florida, which was the top neurosurgery training program in the world at the time, back in the 90s and early 2000s, which is where I was training, they did not do endoscopic spine surgery.
Was it because they just didn't know how, or was
they didn't know how?
Okay.
Yeah. You see, what's happened, unfortunately, in the last 30 or 40 years is that there are companies that manufacture devices. They're called device manufacturing companies. And an example would be Johnson & Johnson DePuy or Medtronic or SynthiSpine. These companies manufacture devices like screws, rods, cages, spinal cord stimulators. I mean, the list goes on, right? Intercept device. I mean, there's so many. There's hundreds of devices. They're all patented and owned by these companies. Those companies have infiltrated our training centers, and they are now paying off surgeons spine surgeons, for example, orthopedic surgeons, to place these devices in their patients. But none of these devices cure back pain or neck pain unless you perform a fusion device. And if you perform a fusion, you can cure back and neck pain coming from the disc or facet joints, okay? But we now have ways to cure back and neck pain coming from the disc and facet joint without fusion, without implants. But these companies stand to lose hundreds of billions of dollars if surgeons stop putting in screws, rods, cages, and stimulators. So they're not stupid, these companies. They're CEOs and vice presidents. They have made decisions 30, 40 years ago. Let's get ourselves integrated into the training hospitals. Let's provide a supportive role where we go in and help these surgeons, facilitate it for them to put screws and rods into patients, for them to put stimulators into patients. So back in the 90s when I was training, the representatives of these companies would be in our operating rooms every single day pushing their devices to be put into patients.
Hey, you got to use this cage, you got to use this screw. And they had to monitor and supervise to make sure that you did so.
The reps would be in the operating room, usually at least one, sometimes two, sometimes three reps with a regional vice president of sales. And they would even bring in a new set and they would have the hospital sterilize it so that you could put it into that patient. And they would say, hey, why don't we try putting some of these new screws in? They have a more favorable angle, you know, or these new rods, they're thinner, they bend easier, they contour better. So they were always pushing new technology in the operating room, even whether it was in the operating room or outside the operating room, pushing the doctors, pushing the surgeons to put in new technology into patients. So there's big money to be made. We're talking tens to 20, 30, 40, $50,000 per surgery for these companies. And they're making billions of dollars in profit putting these devices in. So these companies basically have taken over spine care to where every new doctor being trained in spine surgery, whether it's neurosurgery or orthopedic surgery, is getting exposure in the operating room, outside the operating room, in training centers, at national meetings, to put in these devices into patients because it's so profitable. I'm going to tell you another thing that happened in residency. I did a craniotomy for a very complicated aneurysm with one of my attendings, Dr. Lewis. All right? It took us 5 hours to do the surgery, another hour or so to kind of clean up and get the patient to the recovery room. So let's just say 6 hours of work. I went and looked up how much we get paid for that craniotomy for the aneurysm. Very difficult surgery, okay? And you have to manage the patient for the next 3 months without any additional payment.
Okay.
The payment to the surgeon for that was $2,500 for that 6-hour brain surgery to cure an aneurysm and 3 months of caring for that patient. $2,500. But the payment for the spine surgeon to do a 2-hour surgery was $25,000. So we got a problem here.
Yeah.
We got brain surgeons doing vitally necessary brain surgery being paid 10% of what a surgeon doing complicated fusion surgery on the spine gets paid. There's a disproportionate payment. There's a reward for doing invasive spine surgery, and every surgeon knows it. It's not like they don't, okay? So every neurosurgeon today does about 60% spine surgery and about 40% brain surgery. That's what most average neurosurgeons do. But there's a tremendous financial incentive from reimbursement to do more invasive spine surgery. It's the highest paying surgery there is.
Yeah.
So you've got financial rewards for the surgeons from the insurance companies to do more invasive surgeries.
Yeah.
You've got financial rewards to the surgeons from the implant companies, device manufacturing companies, in the form of royalties and consulting agreements, advisory agreements, where they're paying surgeons money to be a consultant, where they can basically take you out for a steak dinner, ask you a few questions, and then pay you $5,000 for your advice. right?
Yeah.
So they're getting that money if you're putting the screws and rods in patients. So you're making the company's money by putting screws, rods, cages in patients, and you're getting double rewarded, one by the insurance company for doing it, and then again from the device manufacturing company for doing it.
Oh.
Okay? Meanwhile, the patients are getting screwed.
Yeah.
Literally getting
and
screwed.
figuratively. Yeah.
And it's all financial. Everyone wants it. The hospital wants it. The hospital makes 150 grand for a complicated spinal fusion. Okay? The hospital makes maybe $25,000 for brain surgery. So the hospitals want the invasive spine surgery. The companies making screws, rods, spinal stimulators, all these devices, they want it. They're making billions of dollars for it. The surgeons make more money for doing it. So I started to see this, and I started to realize we got a problem here.
Yeah.
There's tremendous financial incentive for hospitals, doctors, and companies that manufacture devices to basically put these devices in patients, even though they're not working, right? With most spine surgery, it doesn't cure the pain. So that's when I started to really ask, well, is there a less invasive way? And combining with my experience endoscopically, going in, minimally invasive, with the laser to clean out the tears, get rid of the pain, using plasma to destroy pain nerves.
Yeah.
Basically, we could cure pain now, not just ameliorate it, right?
Yeah.
We could cure it so the patient doesn't have the pain anymore. They don't have to be treated anymore.
Yeah.
And we can do it without implants. But guess what? The companies that make these implants, they don't want patients to know this.
No.
They have stifled it.
Yeah.
I've gone to the highest levels and they have blocked this information. They don't want the surgeons to know about it. They don't want hospitals to know about it. They don't want patients to know about it. So it's a huge problem. And we've got to get the word out because people are being hurt through these surgeries that are invasive, putting all these devices in them that don't even work.
It's unnecessary.
Yeah, it's unnecessary at this point because we have a treatment that works.
Yeah. And leading up to that, why did you decide to found Deuk Spine Institute, and what did you want to do differently from other spine practices?
Yeah, so Deuk Spine Institute was founded to basically further the progress in spine care, right? And what the idea was we wanted Deuk Spine Institute to be a hotbed of ideas that are better for the patient. Basically, spine care that's better for the patient. That's really what Deuk Spine Institute's about. What techniques, treatments, diagnostics out there are going to give a better result for the patient? See, in the end, what matters is the patient. That's why we go into medicine. We want patients to feel better. We want to do what's best for our patients. But I wasn't getting that elsewhere. The hospitals weren't pushing for that.
No.
The implant companies certainly weren't pushing for that. Surgeons, neurosurgeons, and our leadership wasn't pushing for it.
Yeah.
So I created this Deuk Spine Institute for the purpose of basically understanding, researching, investigating the best treatments that are available to get patients out of pain in a way that is safe and effective. And what I mean by that is it works, but it also lasts.
Yes.
Right?
That's important.
It lasts.
Yeah.
It's durable. It's permanent. Our treatments are permanent. So that's why I created Deuk Spine Institute, because I wanted a place where patients could go to get the very best treatment in the world for back and neck pain, to where they get cured without complications, without problems, and a fast recovery.
And with that, you use your procedure, the Deuk Laser Disc Repair. Can you explain what the Deuk Laser Disc Repair is and why it's considered a cure for back and neck pain?
Sure. So the Deuk Laser Disc Repair is a procedure that I developed and pioneered about 20 years ago, this coming July. And the Deuk Laser Disc Repair is a minimally invasive procedure with just a 1/4 inch incision in the lower back for back pain and a 4 millimeter incision in the neck. And through that little cut, we put a tube, we go into the spine exactly where the pain is coming from. And it turns out in 85% of people out there with back pain and neck pain, that their pain is coming from a small tear in the back wall of the disc that's hurting. Now, most patients that have back and neck pain don't have one disc that's hurting. There's usually 2 or 3 discs. And the average is 2.5. So if you took every patient with back and neck pain, 85% of them, the pain is coming from disc, right? A disc injury. And it's coming from 2.5 discs. So if you only fix one disc, they're still going to have pain. You got to fix on average 2.5 discs per patient. Some patients it's 1, some patients it's 2, some patients it's 3. But because it's 2.5 on average, based on our data when we looked at our patients' outcome, that means about half the patients it's 2 and half the patients it's 3 discs that are hurting. So the Deuk Laser Disc Repair, we target the source of pain, which happens to be inflammation happening inside the disc. If you think about it, the disc is a cushion between bones, right? So if you're up walking around, bending, twisting, lifting things, you're putting pressure by carrying things. You're putting more weight down on your discs in your lower back or your neck. Well, that extra pressure bulges out right where the tear is because it's the path of least resistance, right? So the jelly in the middle of your disc that absorbs that extra lifting, that energy, that compression, it's pushing the jelly right against the tear. And that's why it hurts so much. It's causing inflammation. So it's kind of like if you had a pimple, right? It was real painful, tender. If you start pushing on that pimple, it hurts more.
It hurts,
It doesn't hurt less, it hurts more. So you feel that sharp pain when you push. Well, when you lift or bend or twist or do anything and you have a bad disc in your back or neck, you're basically pushing on the tear. You're eliciting that pain from that inflamed area. So what I do with the laser and the scope is I go in, and with the scope I can actually see all the way down to about 1/20th of a millimeter. So think about that, right? Regular spine surgery, you know why the incision is so big for regular spine surgery? Because the surgeon can't see the spine. So we make a big incision, we peel all the muscles off the spine so we can see it. See, traditional spine surgery is done with the eye, the surgeon's eye. You look down there and you've got to be able to see the spine. So you need lights, big incision, let the light in, and you use your eye to see. Well, your eye can't see 1/20th of a millimeter. Take a millimeter, which is the space between your finger, just enough to see light, cut it into 20 pieces. With the endoscope, the Deuk Laser Disc Repair endoscope, I can see 1/20th of a millimeter. I can see basically 1 cell layer thick of tissue. And when I'm using the laser to clean out the tear where all the back and neck pain comes from, I can see the laser zapping away 1/20th of a millimeter of tissue. It is the most, sensitive, specific, precise surgery done in the human body. There is no surgery that is more precise than 1/20th of a millimeter. So it doesn't even compare to open back surgery.
Compared to just how fusions and laminectomies, the 6 to 12-inch incision in the back, this of itself is just unbelievably groundbreaking. And it's just really mind-boggling to really comprehend that, like, this is now the way to go. And then to my follow-up, when it comes to indicating these pains off of patients, diagnosing them properly, why do most spine surgeons and pain specialists get wrong about diagnosing and treating back pain?
That's a great question. So basically, the reason why back and neck pain are misdiagnosed, and they are misdiagnosed, to your point, they are. The reason is, number one, the belief system. You understand? The belief system. It is information and knowledge, beliefs that are passed on from generation of doctor to generation of doctor.
Yeah.
This occurs, it's an indoctrination process that occurs in medical school and residency. It happens everywhere. Nurses, therapists, doctors, they're all taught to believe back and neck pain cannot be cured. So nobody's looking for a source. Nobody's looking for a cause. You understand?
Yeah.
It's undiagnosable. That's what you're taught. That's what I was taught, even in the top neurosurgery program in the world. And so I came out of training being taught by all my teachers and everybody, if somebody has back pain, send them to pain management. They're going to do shots and pills. They're going to get them on opioids, you know. And these patients are, back in the 80s and 90s, I mean, we put millions of patients on opioids, narcotics, right?
Yeah.
OxyContin, oxycodone, and they got addicted to these painkillers. And now 80% of heroin addicts on the street are patients, former patients who had back, neck, knee, orthopedic pain, and they were treated by their doctors because they couldn't figure out where the pain was coming from or how to fix it. So they put them on these pain pills, and these people are addicted. Now they're living on the streets. Now they're addicts, and their lives are destroyed. So back and neck pain, joint pain destroys lives. That's really what bothers me the most about this whole medical field, and that's what's driven me the most, is all the lives that have been destroyed by pain when they could have been cured so easily with a minor procedure that we do at Deuk Spine. Instead, doctors have misdiagnosed these patients with saying that there's no cure, we don't know where it's coming from. So you ask, what's the number one reason why doctors struggle to diagnose back and neck pain? Because they believe it's undiagnosable. You understand?
Yeah.
That's number one. Number one, number two, number three. I fought that.
Yeah.
I fought it. I chose to not believe it because I saw a few patients when I operated as a resident and we did fusion on their back. We cured their pain. So that result of our treatment basically goes against everything I was taught, that you can't cure back and neck pain. So then why do we cure it?
Yeah.
Right? Then there was one more thing that happened that really got me thinking about it. And that is, there's a condition in neurosurgery that is the most painful condition, period. It's called discitis. And what discitis is inflammation of the disc, usually due to an infection by bacteria, okay? So I saw a couple of patients in neurosurgery training for 7 years at University of Florida with discitis, and my attendings, they all said the same thing. It's the most painful condition in medicine, discitis, okay? So I'm like, wait a second. You're telling me an infection of the disc is the most painful condition in medicine and it's causing back pain, and yet you're telling me you don't know where back pain's coming from? You just told me where back pain's coming from. Discitis, inflammation in the disc, right? From an infection of the disc. And then we know that when you go in there and clean out the disc surgically and you get some of that disc material, you look at it with a microscope, you stain it, you culture it, that nothing grows in that disc about 50% of the time. So wait a second. If it's an infection, but it doesn't grow anything.
That's what got me. Yeah.
Maybe it's not an infection, it's just inflammation. So I started to think about this. It really dug into the back of my head, along with the fact that we were curing people by fusing their spine, right?
Yeah.
So I started to think maybe there is specific causes of back pain, but we just don't understand them. We don't know them. We don't understand them here in medicine, right?
Yeah.
So I kind of graduated back in 2004 from the University of Florida with that thinking that I can cure some back pain, maybe not all of it, but some of it with surgery, right? So I started treating patients in private practice when we opened Deuk Spine Institute up in 2004. I started treating them here in Brevard County in my practice. I saw back pain patients, and I would send them to the pain management doctor because I had no idea. Why are they having back pain, right? No idea. And the pain management doctors would do their shots and their stimulators and their morphine pumps, and they would just screw these people up even more, right?
Yeah.
But that's the thing to do. You send the patients to pain management because that's what you're supposed to do.
Yeah.
That's what we were trained to do. Every doctor's trained to send the patients to pain management. Well, something happened quite fascinating. And this is why I believe all of this, everything in my life, is powered by God. Okay? My sister, a chiropractor in Los Angeles, she was treating work comp patients in California, work comp patients, people with back pain from work injuries. She was doing chiropractic for them. Well, they changed the laws in California where they stopped paying chiropractors.
Really?
So she called me one day and she said, this is back in like 2006.
Oh,
She
okay.
called me one day and she said, this is 20 years ago.
Oh.
She said, I'm struggling, you know, blah, blah, blah. I said, why don't you come to Florida and you can do physical therapy on my patients I'm doing spine surgery on. You can be their therapist. So she said, well, come check it out. She came out with her husband, Terry, who is an MBA, and they saw that there was an opportunity to treat patients here in Florida and actually get paid. And so she came out with her husband and started treating patients with back and neck pain. What's amazing about Dr. Schrumpf, my sister, is she actually could diagnose the source of pain in a lot of patients. She diagnosed them with things like piriformis syndrome, which I had never heard of in my life as a surgeon. Never heard of it. Sacroiliac joint pain. Never heard of it. Facet joint pain. Never heard of it. Right?
Yeah. Wow.
So in my training as a top neurosurgeon at the top program, we weren't exposed to these diagnoses because they're not surgical diagnoses. Neurosurgeons don't treat them. They're maybe pain management diagnoses. So we send these people to pain management. So she started to teach me, what is sacroiliac joint pain? How do you diagnose it? How do I know to send this patient to you, Tanya, for sacroiliac joint pain? Oh, the pain is here, right?
Yeah, yeah.
Well, how about
Indication.
piriformis? The pain is here. So I started to realize that there was a specific cause for most back pain.
Yeah.
And pretty soon, every patient that came to my clinic, I was diagnosing them. Oh, we got disc pain, facet pain, SI, piriformis. And I was sending them to therapy, right?
Yeah.
But the patients could never get rid of their pain. They would just keep going to therapy. And I hired a pain management doctor to do shots because it was really hard to get patients into pain management. They were so booked up, these pain management doctors. They were like 6-8 weeks, like just to get a patient in to be seen by the doctor, and then another 6 weeks to get a shot.
Oh.
Oh, it was terrible.
Oh,
And
my God.
I'm seeing the patient. They're like in pain, and they're in my office, and they're like crying in pain. And I'm like, I don't know what to do. I mean, it's 3 months before you get your shot.
Yeah, I'm just
right?
like a 3-4 month process just to
Yeah.
get your back pain fit.
So I
fixed.
said, the hell with this. These guys, they're crazy, these doctors. I'm going to hire my own pain management doctor. So I hired Dr. Patel,
Yeah.
and I put him to work, and he got busy real quick.
Real quick.
And we got people their shots like within a week instead of 3 months.
Yeah.
So we improved the quality of care by seeing them and treating them sooner in a week rather than 3 months, right?
Yeah.
So Dr. Patel joined, and he was also familiar with facet pain, SI pain, and piriformis pain. So he was actually treating those with shots and then referring the patients to Dr. Schrumpf for therapy. So shots and therapy, and sometimes pills like muscle relaxer, anti-inflammatory. But the same thing kept happening. Patients would come back after 3 months and they were in pain again. And I said to Dr. Patel, why are they still in pain? He says, because we don't have a cure to this pain. We just treat it. It's called pain management. It's not called pain cure.
Yeah.
I'm like, well, if there's a source, there may be a solution.
Yeah.
So I started to look at these areas that were causing pain and thinking, how could I get rid of this pain, right?
Yeah.
And then not long after that, a few years later, SI joint fusions came up, sacroiliac joint fusion for sacroiliac joint pain.
Yeah.
And so we tried a few, but they failed. The patients did not do well. As a matter of fact, I'm operating on one tomorrow who, not one of my patients, but another doctor did bilateral SI fusion, and they still have SI pain. And a paper just came out a few months ago from Norway showing that SI joint fusion doesn't take away back pain. The pain is still there. So I started to ask Dr. Patel, why do they have this pain and what else could be done? And he said, we can do a rhizotomy where we put a needle in and try to burn the pain nerves.
Yeah.
Except it's not covered by insurance. They don't want to pay for it, and it doesn't really work. And I thought, well, if there's these 5 nerves that are responsible for all the pain, why wouldn't it work if you're destroying them? I mean, he said because nerves grow back. As a neurosurgeon, I know peripheral nerves can grow back, but there are specific requirements for peripheral nerves to grow back. And that requirement is that the tube that they're in, all right, which is called the epineurium and perineurium, that tube of connective tissue must remain intact. In other words, it cannot be cut or disrupted, and the nerve will grow back. But if you cut it and disrupt it, then the nerve cannot grow back. The pain nerve cannot grow back. So I pioneered a new technology called the Deuk plasma rhizotomy, where instead of just temporarily zapping the pain nerve so it grows back, I literally slice right through that epineurium perineurium and destroy it, and the nerve can never find its way back. It's a permanent rhizotomy. And we've patented it now.
Yes,
and
we have.
We own the patents for it at Duke Spine Institute. All right, so then I started looking at piriformis syndrome, and I thought, well, the only thing that really gets rid of piriformis muscle pain in the buttock, the sharp stabbing pain in the top of the butt cheek, is to release the muscle. And we were sending our patients to Dr. Glenn, an orthopedic surgeon locally. And when they went up there, the incision on their butt when they came back was this big, and their muscle was destroyed and sunken in. And that's the gluteus muscle. It's not even the piriformis. It's like muscles you still need. So, and the patients would only get relief about 25% of the time. But the release needed to be done to get the relief. So I'm like, there must be a better way to do this, like more reliable results, less trauma, less scar tissue, less bleeding, no hospitalization. So I started to study the anatomy, and I realized that the piriformis muscle attached to the top of the hip to the greater trochanter, right on the medial surface, like right there. And if you actually target that spot instead of the middle of the muscle where the tear is, that you could release the muscle right there on the bone with no damage to anything, no arteries, no veins, no nerves. It was perfectly safe, and there's nothing there, and the recovery would be literally immediate. And so we started doing that, and lo and behold, every single patient, the pain is gone when they wake up from this procedure. It's a literally 15-minute procedure.
Yes, absolutely incredible. Watching it and seeing the patients afterwards, it's really just a miracle just to see that and having that permanent pain relief. But then going back to temporary pain relief, such as fusions and laminectomies. Yes, as we talked about, it's like, yes, they do work, but there's so much risk.
No, they don't work.
Yeah, they don't work. Excuse me. They're like they don't work. And there's
laminectomy and microdiscectomy are surgeries that were originally designed to treat spinal tumors.
Yes.
And the surgeons, though, for the last 60 years, 100 years actually, have just used them now to unpinch nerves. So for patients with weak legs, you can do a laminectomy, discectomy. It will help to strengthen your legs, but it doesn't do anything for back pain except make your back pain worse. So those treatments are not for back pain.
And it was leading to my next question. What are the real risks and failures of spine surgeries like laminectomy and spinal fusion, such as that?
So that's a great question. The real risk is complications, right? Those are invasive surgery. Laminectomy, you know, we've shown videos on this. It's a big cut. It takes a long time to heal. There's lots of scar tissue, lots of bleeding, and a big risk of complications like instability of the spine afterwards, because the surgeon's removing normal bone, normal ligaments from your spine. And they're also removing something called the facet joint. The facet joint is a joint that holds your spine together. When you start removing the facet joint, like in a microdiscectomy, you take 50% or more of the facet joint out, you're going to create instability.
Yeah.
So why are surgeons recommending these treatments? I'll tell you why. Because they lead to more surgery. And they're recommending it because the patients don't know that microdiscectomy, laminectomy is going to cause them to need more surgery. But the surgeons want more surgery. They want the big fusion cases. So if you tell a patient, hey, you need a fusion, the patients say no, and they leave your office and you never see them again. Well, the surgeons have learned from that, and they're like, well, you don't need a fusion right now. You need a laminectomy or discectomy. And the patient's like, that sounds pretty good. And then they get it done. Afterwards, they get more back pain, and then they come back begging for a fusion. So surgeons are using laminectomy, discectomy for the surgeon's own benefit, not the patient's benefit. And patients are falling into that trap. Just getting back to the last question. You asked, why do doctors not know the causes of back and neck pain? It's because of indoctrination, and it's because they've never taken the journey to discover the causes of back and neck pain that I took. And I was fortunate. As I said, God led me. My sister came here, Dr. Patel joined, and then I started to understand all the causes of back pain and neck pain from them. So not every doctor has a Dr. Patel, Dr. Schrumpf to teach them after their training. And a lot of neurosurgeons and orthopedic surgeons, believe it or not, a lot of them are egotistical people. They already know everything. You can't teach them anything, so they're not going to learn very much after their training. And everything they learn in training is that back pain and neck pain is not curable. So we got a big problem. You got therapists who don't want to cure back and neck pain because they want to keep treating you. You got pain management doctors who don't want to cure back and neck pain because they want to keep doing the shots and the procedures they do to make money. Just everybody wants patients, unfortunately, to stay in pain, except for Deuk Spine. We pride ourselves on being different and being better by being patient advocates, by advocating for what's best for the patient. And that's why we do things differently.
As much as we really express that belief for ourselves, it's hard. It's really sad that of the corruption and all the systemic stuff, just the failures going on in the medical industry of itself, with all the greed, the policy making, and it's just brutal. And my next question would be, what corruption or systemic failures have you personally witnessed in the spine care industry, as we talked about?
Yeah, we've touched on a lot of it, but I'll recap it because it needs to be discussed. All right. Unfortunately, the medicine of today, 2025, is different than the medicine that was practiced just 50 years ago. 50 years ago, there were some problems with medicine, very mild, very minor, but for the most part, 50 years ago, the United States of America was ranked #1 in the world for medical care. And we had people coming from all over the world here to America to get the best medical care in the world. Today, America has fallen from #1 down to number 64 in the world.
Significantly.
And
much
why? Why is that? And that is one word: corruption.
Corruption.
Corruption driven by greed. So who's responsible for this? If I had to tell you one entity, it's the insurance companies. The health insurance companies have driven America down to the bottom of the pits when it comes to quality of health care. All right? How do the insurance companies do it? It's very complicated. I'm not going to go into it right now. We'll talk about it in a future podcast.
Of course, yeah.
But the second biggest problem is basically medical device companies. You have all seen how influential pharmaceutical companies can be in driving treatments. Okay?
Yeah.
Let's take narcotics, right? Opioids.
Yeah.
The opioid crisis. So what happened? What happened was a lot of Americans started to develop orthopedic problems, back pain, neck pain, joint pain, right?
Of course, yeah.
And back in the 80s, there was no way to fix it, so the best we could do was take pills. And the pills that were produced and provided at the time were narcotic opioids. We know opioids kill pain. They kill acute pain, pain that is relatively new.
Yeah.
They don't work well for chronic pain, that's for sure.
Exactly. Yeah.
Right. So the companies, the pharmaceutical companies, were manufacturing these pills made of narcotics, and they were so cheap to produce. They were spending 5 cents a pill to manufacture them, but they were selling them for like $5 a pill.
Yeah, it was
So the
way
profit
more.
was massive, right? So here's an example, folks, of where a medical device company, which is your pharmaceutical company, is basically producing a treatment that is basically becoming accepted as the norm, and they were out promoting that treatment to doctors. They had sales reps. The sales reps were going out to doctors' offices. They were meeting with the doctors. They were telling the doctors, this new pill is great for people with back pain. Back pain is the #1 reason that people go to the doctor's office. So these reps were going to the doctor's office, and they were telling the doctors to prescribe this narcotic. Now, we all know, what do you do when you give a patient a narcotic? They get addicted.
Yeah, exactly.
Then guess what? That patient's coming back to you for that narcotic prescription next month. So
Yeah.
these drug companies, these pharmaceutical companies, manufacturers, were basically going to the doctor with a product that basically made the doctor a legal drug dealer, right?
Yeah.
With a captive, what do you call it? Captive customer, right? The patient.
Yeah.
So by giving the patient a 1-month supply of narcotic, they knew the patient's coming back. Every month, they're going to pay for the office visit. They're going to pay for the prescription. Pharmaceutical company makes bank.
Yeah.
Doctors make bank.
Yep.
And the doctors become known as the place to go for back pain, right?
Yeah.
So they get that extra business because everyone talks about, oh, go to Dr. So-and-so, he's writing narcotics. So that's what's happening in the medical device industry. In spine, for example, these companies are manufacturing screws, rods, cages. They're promoting it to the doctors to promote it to the patients.
Yeah.
The doctors are getting financially rewarded to put these devices in people. That is the second biggest source of corruption today in the spine world, is the device companies that are paying off doctors, surgeons, neurosurgeons, orthopedic surgeons, and others to basically put their devices into patients. That is corruption at its finest.
And it's just, it's brutal to hear about that, because somebody who wants to who would be listening to this and is just finding out these truths, is these very harsh truths, asking themselves, I mean, like, is there a way, is there a possibility? And leading up to my second to last question here, for someone listening today who has been suffering for years, what's the first step to getting their life back?
Yeah, the first step to getting your life back, if you are suffering with chronic back and neck pain, which is just back and neck pain you've had for more than, say, 2 weeks, the first step is to understand that Deuk Spine Institute can cure your pain, period. We can cure the pain. And how you get there is you start with what's called a free MRI review. We offer a free MRI review. Now, the reason we want people with MRIs to be the ones to come is because you need an MRI. I need an MRI to help diagnose the source of their back pain. So by requiring an MRI to be done first, we're basically saying, okay, we want the people that are serious about getting their back pain fixed, the ones who have gotten an MRI that we can use to help diagnose the source of their back pain or neck pain. And the real key, though, is what's called the Deuk Spine exam. And this is a type of physical exam that we perform at Deuk Spine Institute that allows our doctors to diagnose the exact source of your back and neck pain. And it is just that. It's an examination. It's not an MRI or CAT scan, X-ray, nerve test, whatever. It's a combination of diagnostic tests combined with a physical examination that we're doing on the patient. It's an interactive exam. It requires feedback from the patient. We've got to identify the pain generators, the sources of pain. There are 30 different pain generators in the lower back and 30 in the neck. We know every single pain generator at Deuk Spine Institute. I can tell you exactly where your pain's coming from if I can do the Deuk Spine exam. Along with your MRI, you've got a diagnosis. Once you have a diagnosis about what's causing your back or neck pain, now we know the treatment, right?
Yep.
Once you get a diagnosis, you know what the treatment is. We have the treatment for every diagnosis on that list.
Yeah.
So we can cure back pain and neck pain because we can make the right diagnosis.
And like for that, I'm just, you know, for somebody who has back pain myself, you know, to hear that, I'm like, it's head over heels, and I'm just really excited to, you know, for people to tune in, to look into that. And
We've got to get you fixed up, Henry.
I know, right? Tell me about it. It's, but at the same time, I mean, like, you know, one step after the other, it all work out. But given that, for our final question, because we've went through a lot to talk about today, and we want to embrace more with what we're going to do in the future and where we want to go with this. So looking ahead, what's your vision for the future of spine care, and how does Deuk Spine fit into that future?
That's a great question, Henry. So my vision of the future for people's back and neck pain and spine care is this. Number one, get rid of the treatments that do not work, which is 99% of the treatments today that are out there. Epidural steroid injections, get rid of them.
I've took them. They're, yeah.
Facet blocks, get rid of it. RFA, get rid of it.
Yeah.
Spinal cord stimulator, get rid of it. Those are dangerous. Fusion, get rid of it. Laminectomy, get rid of it. Microdiscectomy, get rid of it. Get rid of literally 99% of the treatment. Pills, therapy, it doesn't work. These treatments, they are dangerous in many ways. One way, if they're invasive, you're exposing a patient to risk associated with surgery. Blood clots, heart attack, pneumonia, right? Post-operative pain, scar tissue, muscle damage, joint injuries. You're giving that patient really bad medical problems as a result of the surgery. Okay?
Yeah.
And the surgery doesn't work. So let's get rid of treatments like surgeries that are invasive that don't work because they only harm the patient more. They also, there's a psychological component to this too. When patients with chronic back and neck pain do treatments that don't work, they lose hope. When they lose hope, they do bad things.
Yeah.
They treat with alcohol.
Yeah.
They treat with drugs. They may even commit suicide.
Yeah.
I don't want that happening anymore. That's why we're doing this podcast.
Of course.
Because other doctors are not going to tell the patients the truth. So somebody's got to speak up, and that's us. We are literally the first in the world speaking up about this.
Yeah.
We've been speaking up about this now for 20 years. Every week we broadcast surgery live on our YouTube channel at Deuk Spine Institute, our Facebook, and you can watch our surgeries live and learn how to get cured.
Yeah.
You can have faith and hope that we will cure your pain.
Yeah.
Okay?
100%.
The second biggest issue is insurance coverage. We've got to get the insurance company. When I say we, I don't mean Deuk Spine Institute. I mean
general,
people
Yeah.
have got to get their politicians to pass laws requiring the insurance companies pay for treatments that do cure pain, like Deuk Spine Institute's proprietary treatments. All right, so we have to expand. We have to build a few more Deuk Spine Institutes. Fine, let's do it.
Yeah.
We got to train some more doctors how to do treatments that work. Let's do it.
Yeah.
I'm all behind it, all right? But we need laws that protect patients from treatments that do not work. Laws that force the insurance companies to pay for treatments that do work. That's really what we need. We need those type of laws in place to help people get access to care that works.
And then with that, that is the most important thing for us to really envision for us to do is really spread the word out of what we're trying to do, what we're envisioning, and where we're trying to go with it. And I think that is just a mentality to keep as we go along with these episodes, and just we keep the flame ignited as we continue on with this journey. So
Yeah.
I just really appreciate your time, and thank you so much for sitting down with me and with the rest of us, and the CEO and founder of Deuk Spine Institute, Dr. Deuk Majan. We really thank you, and we cannot wait for what Deuk Spine has for the future, and we thank you for your time.
Thank you. Yeah, we have a lot to talk about. We have just today started to peel back the onion, so to speak, and we have a lot to discuss. We have a movie coming out.
Yes, we do.
Very soon, hopefully on Netflix.
Yeah.
Spine Scam. That is a docudrama that starts to dive into some of these things that we've been talking about, right?
Yeah.
The corruption,
The realities of
the realities of it.
Yeah.
And hopefully it'll be a series on Netflix soon. We've got lots of information on YouTube and our website.
Yep.
And hopefully people will start asking the right questions about back and neck pain, which is, how do I cure this pain? Let's stop expecting our pain to be something that we live with, that controls our lives and changes our lives.
Amen.
Let's see it as a thing of the past.
Yep.
That, remember those days when people had back pain? Henry, remember that? That was so long ago. Like payphones and right?
Like just something that's completely irrelevant now.
Totally gone, cured, done. We got to get past this phase of people don't even know there's a cure out there.
Yeah.
And people need to know there's a cure.
Yeah.
And they just got to go to the right place,
Yeah.
It's kind of like when digital cameras first came out. The first one was the Nikon Coolpix.
Yeah.
And I bought that.
I
But
remember
now, lots of companies make digital cameras.
Yeah.
But at the time, there was one. And right now, today, there's one company that cures back and neck pain, and that's Deuk Spine Institute. We're the first, and hopefully in the future, there'll be others, so that we can cure 1 billion people worldwide living every day with debilitating back and neck pain.
Amen.
Thanks, Henry.
Thank you.